This is a video that demonstrates how to fit the Matriarch Maternity Support. If you would please pull out your sample and follow along with this video. This presentation will show you how to measure, fit, and apply the brace. Indications, necessity, description, and basically everything you need to know about showing and selling this brace is on your Matriarch brochure that was sent to you. Now the brace itself, pull out your brace and follow along. This is the back of the back panel with the Matriarch embroider. We can turn it around. We'll show the inside of the brace. The arms fold out and can detach. This attachment allows the patient to grow. And actually, every brace is two sizes. The anterior panel acts as a shelf and helps to disperse the weight of the abdomen and the baby. It's also needed for billing purposes. There is an added option, the hot-cold pack. As I said, this is an option and an additional cost. It can be placed into the freezer or the microwave. It velcros into the back or the inside of the back panel. This option does increase the weight of the brace. However, it provides extra padding for the patient. Currently, it is about 50-50 on whether this is purchased by the account or not, depending on the practice. Measurement. There is also a picture on the one brochure that shows you where to measure. The measurement should be taken just below the apex or the belly button of the belly at an angle. This will give you the idea of which of the three sizes that you need to place on the patient. Now, the application of the brace. The anterior panel. It is placed right below the umbilicus. Or the belly button. This is give you an idea of where the angle of the arm should be. In preparation for brace fitting, always place the brace on a flat surface so that it makes sizing of the brace much easier. Now, we lay the brace down on the table. We place the anterior panel on the arm that has the Velcro strip on it. So we look right there. Half of that panel should be just outside of the arm. So if you would turn so they can see that, just on the outside of that arm. Now, our patient is second trimester. So, the arms of the brace are removed and are placed and angled in a downward position so that the pressure is in an upward direction versus an inward direction. If the arms were parallel or in an inward direction, it could compress the fetus once it is strapped. We do not want this. We want it to support and to lift. Back pain usually happens around the second or third trimester. If it is the second trimester, you would bring the arms toward the inside of the back panel, as it has been done here. Once the arms are there, it velcros in, and we are set to put on the patient. The patient knows where the anterior panel should go, as you've shown her earlier. Have the patient place the hand on the hand strap that has the anterior panel on it. Bring it around and put her hand on the other side of the hand strap and Velcro it as tightly as she can. One thing you could know is that the anterior panel will always be on the patient's left hand. Now we do the anchor strap. This is the inferior or bottom strap. She uses her thumb and pulls as tightly as possible, but you want to Velcro this strap on the bottom edge of the arm. As so. Once this is accomplished, the top strap is set tightly to avoid gapping. Perfect. Once the brace is on, you must be able to slide your hand in on the top of the panel without much difficulty. This shows us that it is lifting rather than compressing.